All right, so thank you everyone for your patience. We're going to go ahead and get started. So again, my name is Kim Rawlings, and I am with CMS. I am the lead or the core for the Measures Management System, and I co-lead all of the efforts with the pre-rulemaking cycle with Helen Dollar-Maples. Unfortunately, she couldn't be on the call today, but you can feel free to contact us both at any time if you have questions. So to leave the maximum amount of time for discussion and the demonstration, we're just going to go ahead and jump right in. All right, so just a couple of housekeeping notes here. All of the lines will be muted during the presentation and the live demonstration, and then we will open it up at the end for questions. We do record this meeting and upload it through YouTube and put it on the CMS website for future viewing, and the slides will be up in the next day or two, but the recording will be up within a week or two. So you can look for that in case you have a colleague that missed it and wants to view, or if you just feel like listening again. So today I'm going to do a very quick overview of the pre-rulemaking cycle and kind of where we are in the process and where we're going in the next couple of months. And then Vince Brown from Battelle is going to do a live demonstration of Jira and walk through the tool and show you the various data fields, etc. And then we'll have a good amount of time at the end to answer questions about either data fields or the process or Jira or, just anything you have questions on. And you can also, as you saw in the scrolling at the beginning, we'll have live questions that you can ask via phone. But if you have a question that comes up, while we're presenting, feel free to, use the Q&A function in WebEx. And we'll answer, we'll run through those questions and answer them at the end. All right. So just a couple of guidelines around proposing for measures. Measures that are currently in use do not have to go on the measures under consideration list. The only exception with this is if there's a substantive change with that measure, like a change in population or a change in setting, really something substantive, then, that measure would need to go on the MUC list again. But if it's actively used in a program, it's in the program and does not need to go on the MUC list. Measures that were submitted in a prior year but were not accepted in any, not accepted by any CMS programs are eligible for resubmission. And if you submitted a measure to be on the MUC list but it didn't get on the MUC list, also eligible for resubmission, but I would encourage you to take the feedback that we've given as to why and try and rework the measure a little bit. And again, measure specifications change over time, so if you're in your annual kind of evaluation and maintenance, again, if there are any significant changes, we encourage you to reconsider the measure for the MUC list to get broad stakeholder feedback. Here's just a quick overview of the process. So Jira already opened. It's been open since February 26th. At this time, I don't think we have any measures in Jira, but I encourage you to please, feel free to go in there early and input your measures. There are a lot of data fields, and definitely not something that you want to leave for the last minute, especially if there's a technical issue or maybe, there's a new data field that, you weren't familiar with and, might need to craft some data or language, et cetera, for it. Never hurts to get it in early. And that gives us more time to review as well. Jira closes for all measures on June 3rd. And then by mid-July, we will have a draft MUC list prepared for internal purposes. In late July, we will have a meeting of federal stakeholders only where we will kind of preview and get feedback at the federal level for that draft MUC list. And then in late July, the MUC list will enter the clearance process and be reviewed by all kind of critical parties at CMS, and then move on to HHS clearance, where our sister agencies, ARC, CDC, et cetera, will take a look at the measures as well. If you have any questions in more depth about the measures under consideration list, that publication and that process, please feel free to look at our pre-rulemaking website. It has a ton of great information. And of course, at the very end is our contact information, so you can always ask during this call or follow up with us. So with that, I'm going to pass it on to Vince, who's going to talk to you about Jira and what's new for 2019. Thank you.
Thank you, Kim. This is Vince Brown from Battelle. We're a measures management system contractor for CMS, and I'm happy to have the chance to demonstrate and describe some of the changes for Jira on the measures under consideration data collection process for 2019. I realize that some folks on the call today, this may be their first exposure to Jira and entering measures for measures under consideration, so I try to go through how the interface works. And also, I'm aware that some of you have been entering measures, every year for the last 2, 3, 4 years and are familiar with it. So we also try to highlight what is changed from the prior years. This slide shows that the changes, there are several of them listed here, but really, if you used Jira last year for measures under consideration, you will not see much change from year to year. One program was renamed. That actually was the one that was EHR incentive, has been renamed interoperability. So you'll see that program that has to do with hospitals, critical access hospitals, and eligible hospital program. So you'll have a slightly different name on that one program. The other changes that we've made, every year we collect feedback from users on, are the drop-down lists accurate and complete? And so we have several of our drop-down choices that have new words in them to fit, new needs as programs evolve. To me, the most important change for 2019 is in the area of the meaningful measure area. You'll recall that CMS has defined 6 healthcare priorities, and within each of those priorities are 2 or more meaningful measure areas. In 2018, for every candidate measure, users had to select one and only one priority and one and only one meaningful measure area. For 2019, CMS has decided to add a secondary priority and a secondary meaningful measure area if you want to. I emphasize this is an optional field. For every measure, you have to choose one priority and one primary meaningful measure area. But we've had feedback from users that sometimes a measure kind of straddles 2 or more priorities or 2 or more meaningful measure areas. So for the benefit of those who are reviewing and evaluating these measures, you have an option to add a secondary in each of those. I'll show you that when we get into the demonstration. We have 2 questions, one on data sources and then one on how will the measure data be reported back to CMS. Those have slightly different drop-down choices this year from prior years. And then we did change the screen guidance in several places, reminding users that if our drop-down list does not have the exact word or wording that you want or that your program is looking for, then you're welcome to use the comments field at the very bottom of the form to explain or add the words that you wanted for that particular question. That's always been there, but we just added a more detailed reminder in the screen guidance to help users who we sometimes get feedback that, well, the word I need is not on your drop-down. What do I do? And so this is why we added that to the screen guidance. These are similar notes on our user interface. Some of the drop-down lists are quite lengthy, fields such as specialty and registry. They're more than one screen can hold, and you'll see an elevator bar at the right. So scroll down if you don't see what you're looking at when that drop-down first opens. Likewise, referring again to the comments field, if you select Other for most or all of our drop-downs, you can select an other choice. And if you do select other in the drop-down, then you're asked to scroll to the comments at the bottom and describe what that other information is. That way the reviewers know what it is you're talking about. Every year we get a few measures that are really lengthy, and so I'll just remind everyone that the measured title field is truncated at 255 characters. So you may want to edit your title if it seems like it may, so we don't cut off any important information after the 256th character. Likewise, if a certain required question is not relevant to your measure or you don't have the information right then, we ask that you put NA, and that if you leave it blank, Jira will reject the measure. It won't save it. So we ask you to put NA in there. That way we know you didn't skip it. Within the Jira interface, it has a handy feature that allows you to set up filters or searches for looking at just the measures that you want. You know, maybe you're interested only in ambulatory surgical or only in long-term care. You don't want to look at measures in other programs. So you can filter on any of these fields and get the screen looking just the way you want, and then Jira lets you save that as a saved filter. And so I just wanted to make everyone aware of that. The other nice feature for those of you that prefer to work in Excel or other database formats is you can export, and I'll show you how to do that in the demonstration. You can export custom reports. Once you get the screen set up looking the way you want, then you can export that out. It does not go direct to Excel, but it does go to a comma-separated value or CSV field, which you can open in Excel. And then that lets you do whatever downstream analysis you would like to do with the measure data. Once you have filters, you're also, Jira lets you use dashboards, which is a way of putting 2 or 3 or more filters on the same screen. Some people like to look at the data 2 different ways, and so the dashboard lets you save that particular configuration and come back to it. It will refresh every time you go in there with any new measures that are in your interest area. So that's just a feature that you may or may not know about, especially if you're new to Jira. But a lot of our users have found that to be handy. I want to make one plug for our next open forum. If some of your colleagues were not able to be on the call today, we will be doing a similar open forum next Tuesday, the 23rd of April at 1 p.m. Eastern. And then on the 25th, as a later slide will show, we do also have a Needs and Priorities webinar where each program will have a few minutes to describe what its upcoming gaps or needs are for this 2019 data collection season. Also, I would refer everyone to the CMS Pre-Rulemaking website. On that site are many resources that you can use as you gather your measure information, especially a user guide that has all these data fields in it, and they're defined, and the data type that we're looking for, and hints and tips that users can use to help them get their measures in, you know, as efficiently and accurately as possible. I do want to touch on one other feature of Jira. It's really, I would call it a limitation. We get questions about it every year. Unlike a lot of web-based data collection or software, Jira does not support saving a measure halfway through and then leaving and coming back and completing that measure later. So we encourage everyone to have all their measure data together in one place. For that reason, there is a downloadable Word file called the template for 2019, which you're welcome to use and populate offline before you even get into Jira. That's on the Pre-Rulemaking website, and a lot of our users have found that very handy for making sure that all the required fields and any optional fields that they have information for are populated. Then when you get into Jira, it's easier that way to copy-paste from the template into Jira, and you finish each measure in one session. That's familiar to anyone that's used Jira in past years, but I wanted to alert any new users to that. My only other request as far as communicating or what would be helpful is any of you that have contact with other measure owners, remind them of the June 3rd cutoff. It seems like every year we'll get a call on June 2nd or June 3rd and say, can I send you my measure? And you know, it's then we're trying to orient people very quickly to the Jira interface. So if you could help us communicate that to other stakeholders, that may help us get measures in sooner and save a little bit of that crunch time. Okay, I did want to put this splash screen up here. To get into Jira for measures under consideration, you do need to have an ONC Jira account active. And then the user guide describes how to apply to the MMS support email to get your name added to the particular project for measures under consideration 2019. It is a limited access website, so we do need to add you as an official user. So I should say it's not open to the public. So once you log in, if you've used Jira for past years, it may take you to a different year's project. Mine always goes to 2017. So you can go up here to the upper left where it says Projects. And if you've been added to ONC Jira and to the 2019 MUC list user set, then you should have 2019 measures under consideration as one of your project choices. You'll see when now we're in the 2019 project, that's shown in the upper left corner. And as Kim described, the system has been open for a few weeks now. No one has entered any new measure yet. We're hoping that that will begin and that maybe these webinars will encourage users to start populating their new measures for this year. But what I will demonstrate is then to enter a new measure, the first thing you do is go up here to create. There's a yellow button at the top. And a new dialog box will pop open here. You want to again make sure that you're in 2019 project and that this issue type says measure submission. Sometimes different people's configuration will default to a different issue type. So if you want to enter a new measure, choose measure submission there. Basically, it's like a lot of other user interfaces. You have about 70 fields to complete. About half of those are required, and the other half are optional. The required fields are indicated by a red asterisk, which you can see to the right of the label. So here's one, range of years this measure has been used. That is not a required field. You can tell that because it does not have an asterisk. What I would say about this is we encourage users to fill in as many fields as possible. You have to put something in all the required fields or Jira will not save that record. So the ones with an asterisk you have to complete. The optional fields, we encourage everyone to fill those in as much as they have information, because the more information that you put in, then that will go to the CMS and HHS reviewers who are deciding if this measure belongs on the MUC list. And then that information will also be passed on to the measure application partnership work groups in December through January as they decide on the official recommendation to make for each measure. So the more information that they have access to, the better decision that they can make pertaining to your measure. I'll draw your attention to this question here. What is the history or background? So in there you have a choice. It's a new measure, never reviewed or used. It was previously submitted, but now it's being refined because MAP said, we conditionally support this measure, but it needs some changes. So you would choose that if you have refined and resubmitted. And then here's a measure, as Kim described, it's being submitted for a new or different program, or it has undergone substantial change. So that is very helpful as the reviewers understand what is your measure's history. The summary is the measure title. Again, this is the field that is limited to 255 characters only. And underneath each data box, you'll see a small print screen guidance. That should tell you in every case what kind of data that CMS is looking for. These fields have not changed much. For exclusions, we did add a term to that called exceptions. Those can go in the same field, whether they are exclusions or exceptions. I'll scroll down here to the healthcare priority screen. So you'll see that the primary healthcare priority has an asterisk, and the one primary meaningful measure also has an asterisk. Those two are required fields. I'll just demonstrate. If you choose, for example, make care safer, then you'll see that your primary meaningful measure areas are the two that are under that priority area. As you change the priority, make care affordable, now you have different choices down here under meaningful measure. So Jira is context sensitive to what you've selected as your priority, and those are the choices that it gives you for meaningful measure area. So those are the primary. Right below that, then you have the secondary priority and the secondary meaningful measure area. And as I said earlier, those are optional fields. You're welcome to fill them in if you think it will help your reviewers understand your measure, but you don't have to. The NQF ID field, we made one small change to that field this year, which is to allow it to be 5 characters. That is the usual 4 numbers followed by a letter, because NQF now has a letter E, or perhaps some other letters to designate different subsets of measures within the National Quality Forum nomenclature or identifying a number scheme. So that is, that's a little bit different from last year. Oh, I did want to scroll back up to the program decision at the very top. Jira calls these components, but it means what CMS program you are submitting for. And again, these looked about like they did last year. Here's the new title, or the change title, Promoting Interoperability for Eligible Hospitals. And I did want to demonstrate, too, that just as last year, if you are submitting for MIPS, and many measures come in for MIPS every year, you need to decide between whether it's a quality measure or a cost measure. So you should pick only one of those if you are within MIPS, either cost or quality. That's just like it was last year for MIPS. But because it was new last year, I wanted to remind everyone. Like I said, some of these drop-downs are pretty lengthy here. For example, in which setting was the measure tested? So here you would use the elevator bar to scroll to see all the different choices that you'd have in that drop-down. Some of the measures, for example, eCQMs have particular requirements as far as what must be attached in data. So be sure and read the screen guidance if you're submitting an electronic clinical quality measure this year. We asked questions about NQF status. Is it endorsed? Did it lose its endorsement? Is it under consideration at NQF right now? And same with prior MUC list history for the given measure. I wanted to draw your attention to, you must select one measure steward and provide the measure steward contact information. That's who CMS would talk to if they had any question about the measure, or the MAP work groups could contact that steward. There's also an option for a long-term measure steward. That is, if you're the steward now, but you know it will be changing in the future, then we invite you to supply the information on who the long-term or the next measure steward will be. Just a helpful piece of supplemental information. Again, who's the primary submitter, and then you can also add, at your option, a secondary submitter. Here's the comments field. It is a free text box, and so any notes or clarifications, if you want to qualify or say put caveats in there, or any information that was not covered by the available data fields, you're welcome to put in this comments field. If you do use the comments, we'd ask you to indicate in the comments what field you're talking about. Is it a registry, or is it a measure type, or a data reporting type, so that we know which existing field you are trying to elaborate on. If you are submitting for MIPS, merit-based incentive payment system, you are required to complete a peer-reviewed journal article template. That's a separate Word document available on the pre-rulemaking website, and that has to do with a regulation that requires a measure to have been submitted for publication. It does not have to have been published, but at least has to have been submitted, and you're asked to provide documentation, several questions on this separate Word file. So this is where, in the attachment field, is where you can drag and drop files there or browse on your computer, and that's where you would attach it. That's for MIPS measures only. Other types of measures do have attachments. People will put measure information forms in there. It's a classic place for supporting documentation. If you have an ECQM, they're wanting to see Bonnie test files and things having to do with NQF feasibility scorecard that's detailed in the screen guidance. So this would be the place to attach all those files. You can attach up to 10 megabytes. That's a Jira software limit. If you need to attach more than that, just contact us and we'll work out a way to get your information into the reviewers. So like I said, when you're done and you've populated all of your data fields, then you click this Create button. And if you filled in all the required fields and everything is in order, then it will create the issue and you'll start getting email notifications as that measure moves through the review workflow. That concludes the demonstration part. We're glad to talk over any questions. As Kim noted, you're welcome to use the Q&A or chat feature on WebEx interface. If we do not get any questions from the chat box or Q&A box, then we'll see here in a minute if Sarah can open all the participant phone lines. And if she does that, then we would ask everyone to please mute your phone unless you're actively asking a question, just to reduce the background noise so that everyone can hear the questions and answers. So maybe some participants today have questions for Kim's overview of pre-rulemaking or any questions for me on the Jira data collection interface.
Hi, this is Sarah. I'm going to unmute the lines, and if you do not have a question, please mute your line to reduce background noise.
This is Vince. While we're waiting to see if anyone has a question, I forgot that I was promised to demonstrate the filters and dashboard features, so I'll cancel out of this and go to the 2018 project because it has some measures there. These are last year's measures, and so your filter feature is here, and so then these are the buttons that you would use to filter down to find only the measures that you wanted to. For example, if you wanted to select only ambulatory surgical center measures, then you would pick that.
Hi, Vince. You need to share your screen one more time. I took the ball back from you. Sorry about that.
Thank you, Sarah. I missed that. I was so excited. So this is where you would pick your particular component or program that you wanted to look at. When you get the screen setting up and looking just the way you want to, then you can click this Save As button, and that will save that particular configuration or that screen appearance. And then every time you find your filter, you go to your filters, you choose the name that you chose to save that filter as, and then that same screen view will pop back up. So it's a way to look at only the subset of records for that year that you wanted to. Same with dashboards here. This is a dashboard that I had going back to 2017. And so again, you can add a new gadget. They call these, each little mini screen is called a gadget in Jira. So you can have this window that shows one view of the data and then another screen over here to the right. And again, you can manage your dashboards under that dashboards feature. Over here to the right, it says create new dashboard. So that would be how you would do that if you would like to. Some people find it helpful. I think those are the only things I forgot. Kim, you might remind me if I made other promises, but I'm not aware of any. I haven't seen any questions coming. Oh, here's we just saw one coming in on the website. It said, what is the URL for the Jira site? So I believe that's up here at the top. I'll just read it here real quickly. https://oncprojecttracking.healthit.gov. This will also be in the user guide, which is available on the CMS pre-rulemaking website. There's also a quick start guide that's just a 2-page boiled down version of how to get started, and you may find that helpful. Both of those resources have the ONC Jira URL in it. Okay, we have another question that I see. Does the peer-reviewed journal article have to be completed and published at the time of MUC template submission? The answer is no. All that Susan Ardake did describe this on Tuesday's kickoff call, and if I remember it right, Kim, correct me if I misspeak here, but what Susan said was that it has to be submitted for publication, but it does not have to be accepted or published in order to come in on the MUC list.
Oh, this is Kim. Yeah, I'm just reviewing quickly, but I believe what we said yesterday during the kickoff meeting, and again, this is not, I don't actually review the measures, but sorry, I'm just going on our website and looking real quick. I want to say that, so let's see, MACRA requires submission for new measures for publication in applicable specialty. Right, okay, that's what I thought. So, and again, we can definitely clarify this for the person that asks and send something back out to you just to kind of triple check and make sure. But there's a MIPS peer-reviewed template Word document on the website. And you fill that out so that CMS can submit the measure to a peer-reviewed journal article. Like I said, I am 99.9% sure that is how that works. But unfortunately, the person that is in charge of that isn't on this call. But we have your name and everything, and we can definitely follow up. But again, I'm almost certain that it's that you fill out the template so that we can take all of those templates and put the journal article together ourselves, and then, like I said, we submit it for a peer-reviewed journal, for our own peer-reviewed journal article requirement.
I remember, this is Vince again, I remember Susan also saying it would be great if your measure was published or has been accepted. That's not
right.
A problem. That's you know, icing on the cake.
An added bonus, exactly.
Right, but it does not have to have been published before it goes on the measures under consideration list.
Right, you just have to fill out, if you're submitting for MIPS, you just have to fill out that extra template so that we have the information to be able to basically put all of the measures together and do it for you.
Yep. We did have one new question come in, and Kim, this is a good question, I think. I don't know the answer necessarily. It said if the measure was reviewed in a prior year, so I assume that means it was on a previous MUC list, but now it's a claims-based measure with different specifications. Would it be considered a new measure or refine and resubmit? So we have those two different choices. That is, you could say it's an existing measure, but it's undergone substantial change. Or would you say this is resubmitted because of refine and resubmit? I'm inclined to say the latter, that you would say if it's not been deployed in the field, then you would say it's being resubmitted as a refined measure. But Kim, maybe you have a more accurate read on that.
Yeah, so I think what you would want to do is actually, I would actually submit it as a new measure, because refine and resubmit, I think, is specifically around the MAP decision criteria. And I think that what that's saying is that, I'm putting this measure back on the MUC list because it was on the MUC list before, and NQF, the MAP decision was refine and resubmit. Does that make sense, or do you have an additional question? Or, follow-up question?
Yep. No, I think that's good.
Yep. Okay. And that's another one. Again, we will, I'll double check that and make sure. But again, that's, I believe that's what is the expectation for that. Any other questions or comments, either on Jira or the submission process or pre-rulemaking process in general?
I think there's one more coming in just now. Well, that was Sarah saying no other questions that we can see anyway. Don't know if any of the callers have a question out loud. And we did have a request from outside. Someone had logged into ONC and ONC project tracking, but they don't see the 2019 measures under consideration. That is most likely a new user. So what you would need to do is send an email or call us, and we'll get you added to that user list. And then once you're added, you have to be added to that particular project as a user for 2019. And so then once that happens, then the next time you go into ONC Jira, you will have, that will be among your drop-down choices. So that's the way that works. There's one missing step. And there are, I think, 20 or 30 projects within ONC Jira for different uses within healthcare IT. And, different people have different access to them. So you'll see many more projects that may not be relevant to you. But hopefully, once you're added, then you'll see 2019 measures under consideration, and you'll be good to go for this year. If you would, the next step slide, we'll see if we get a couple more questions. But I did mention there is another open forum. It will be similar to today's program. It will be next Tuesday. And then on next Thursday is a 2-hour session where each program will have about 4 to 8 minutes or so, if it's all evenly spaced, to cover their particular program, how many measures they have now in the field, and then where their measure gaps are to help measure owners decide what kinds of measures are coming up on the horizon. Just a reminder that Jira does close on Monday, June 3rd, 2019. And then there's a link on the slide to the pre-rulemaking website.
Nothing else to add, just a thank you for joining us. And, please feel free to, join us next Thursday for our Needs and Priorities webinar. Thank you.
Okay. Thanks, everyone. That concludes today's open forum. Appreciate your time.